Am I too young for a hip replacement? I get asked this question way too often. You might be surprised with what my answer is. So let's go. So am I too young for a hip replacement? Now, there's some absolute key things to consider here, and you may be surprised with what my answer is based on the fact that I am a physio. But seeing patients in this scenario so much throughout my caseload, you might be interested to see that my possibly controversial opinion might surprise you. However, let's get into it. Now, look, for those who have hip arthritis, irrespective of the age, often there might be a recommendation to have a hip replacement. Now, a hip replacement is obviously, like it says, replacement of the joint. So you have a ball and socket joint, it gets replaced. Now, don't get me wrong, it's not ideal to have a hip replacement. You know, more people probably rather than not would rather not have one. However, in that population where you have an arthritic joint, who possibly have had physio and lifestyle advice and changes, loads of conservative input that hasn't responded well to physio, may well be a suitable candidate. Now, identifying who that suitable candidate is does not include age, but let me just explain something to make it a little bit more kind of apparent why I'm saying this. When someone needs to have a hip replacement, there are massive impacts on two things, right? If you've got an arthritic hip, it will impact your physical ability because you've got pain, you can't walk, you can't be sociable, you can't do sport and exercise. And then on the other side, it impacts your emotional well-being, right? Because you can't do that stuff and you're in pain. So you're living with pain, it impacts, you get anxiety, stress, maybe even depression, and all of those factors, making it really clear that you've got a physical thing that has a psychological crossover. These two things overlap. Now, historically, way back when, hip replacements lasted 10 years, right? Cast your mind back, before the internet, before we had phones. We're all using Nokia 3210s, no iPhones in sight. They used to last 10 years. So the narrative was, come back when it's worse. Don't come, wait till you're walking in on your knees, hobbling in, you're in tons of pain, so that you can offset the need for a revision. Now, revision is like it says, you replace the replacement, right? It's the kind of B track to a replacement. Now, back then, when replacements used to only last 10 years, then yeah, I get it. You would want to offset it if you're a young adult so you don't have so many hip replacements throughout your life. However, things have changed. As of now, hip replacements are lasting 20 years, give or take. Now, cast your mind back to 20 years ago. We're talking 1999. If you go back 25 years, my maths needs to improve. But let's say 25 years to make it more dramatic. You go back to 1999. Things have changed. The kind of hip replacements being done now, minimally invasive, advanced prosthetics, robot assisted, skill sets have increased. Now that means that they're lasting probably going to go 25, 30, 35 years. Meaning that you can absolutely have such a greater survivorship than people think. Then it begs the question, if you're a young adult in your 30s, for whatever reason, and you're a suitable candidate for a hip replacement, you probably are going to need a revision at some point. But the question is this, do you want to live your life active, strong, with a better quality of life, without it impacting your psychological well-being when you are young and active? Or do you want to put it off, live your life when you're younger, in pain, with a degree of disability because you can't do the physical things that you want, and just offsetting the inevitable? The important thing to consider here is when you're looking at the research, looking at the evidence and trying to understand if someone is a suitable candidate for a hip replacement, age cannot be taken into consideration, not in isolation for sure. So if you're a young adult and you've got symptoms that are because of a hip arthritic kind of condition and you're struggling and you are a suitable candidate and it is an option, my perspective is you can have an absolutely fantastic outcome with a hip replacement and have a quiet longevity to it with an active life. However, it's important to consider here, I don't want everyone to run and jump into the orthopedic waiting list to have a hip replacement. Right person at the right time for the right situation, it can be absolutely fantastic. And in order to demonstrate that, in order for me to show the people watching this video just how effective it can be and suitable, I want everybody watching this who's had a young or let's say a hip replacement in their young adult life, to comment below with how it went, their recovery, and how they found it. Because I've done this on another platform, and I guarantee you I've had an inundated amount of people commenting saying, actually for me it was life-changing. Don't get me wrong, we don't all push everyone towards a hip replacement. However, for some it can be absolutely fantastic. And in order to facilitate a little bit more learning into this in other videos, we're going to go through some more insights, some more evidence, and also more importantly, for those who are having surgery, how to manage your exercises and what to expect from the surgery. So if you've enjoyed this video, please get involved, comment, let me know your thoughts, and click on the next video to see some more hip related content.